All right, good afternoon, everyone, and welcome back to tonight's webinar. Thank you for attending, and yeah, if you didn't attend last night, good to see you tonight. So my name's Jack. I'm the project officer here at StockSense. So I'll tell you a bit about StockSense. StockSense is a project run by the Victorian Farmers Federation. We're funded by the Cattle Compensation Fund and the Sheep and Goat Compensation Fund, and proudly delivered by the VFF Livestock Group. StockSense was established to help Victorian livestock producers maintain and improve animal health and welfare, as well as Victoria's overall biosecurity status. So we do this numerous ways. We have educational workshops, webinars, develop fact sheets, and we have a monthly newsletter. And yeah, you can go to our website to look at that. So here's a few upcoming workshops. We have one in Altham, which is a hobby farm livestock essential workshop on the 10th of July, and one in Gisborne about post-lambing care. So just head to the website to find out more about that. You can sign up right now. And then we also have another webinar about selecting the right goat and a little bit about the traceability requirements for that. So tonight we have Rob again, Dr. Rob Bonanno again. So 6 to 7:30, and tonight's going to be about calving interventions and problem solving. And then so how we'll run, we'll have an hour presentation, and then hopefully around half an hour for Q&A. But we'll see how we go. And these slides will be sent out to everyone. I'll send them out at the end of this webinar, and then the recordings for them will be put up on our YouTube channel in the next couple of days. Also, at the end, I'll get a survey up. So if you didn't do it last night, I'd really appreciate it if you could fill it out tonight. That's just a few ways how you can stay in touch with us. Yeah, we've got Instagram, Facebook, and YouTube, and that's our email and website. This is just some other stuff about the VFS and projects. So we've got MOFs, which do free farm safety visits, and we have a VFF farm business support, who, yeah, connect farmers with grants and yeah, stuff like that. So, yeah, I'll swap over to Rob and yeah, we'll continue where we left off from yesterday.
Hopefully that will work. Can you see my screen?
Yeah, perfect.
Wonderful. Okay, fantastic. Look, thanks very much, Jack, for the introduction. For those of you who were joined us last night, you're suckers for punishment. You're back again. And for those of you who are just joining us tonight for the first time, the first few slides I'm going to do tonight are just a quick recap of what we covered last night, because I do think it's important. My wife always tells me that she's got to tell me things at least 10 times before I remember them. And so I think that if we go over these, key ideas again tonight, it won't be wasted time. So realistically, there's a couple of things that I encourage people to think about when we're talking about calving time. And it's the management prior to calving can really affect the viability of the calf. And the good supervision and timely assistance when required saves lives. Last night we talked about these sort of main sort of themes, I guess, were the main things we talked about. One was about preparing for calving, getting ourselves actually ready for, on the farm for the calving process. We went through the stages of the labor so that we know what normal is, because if we don't know what normal is, we can't really easily identify abnormal. And then talking a little bit about prevention of the dystocia or calving problems. And then last night we also dived into a bit more around assisting with the dystocias or the calving problems. And I told you all about the 20-minute rule, and I'm going to reiterate that again tonight because I do think it's a good one. And we'll talk a little bit about the care of the newborn calf. So last night we talked about the calving kit. Now, I think that every farm should have one of these on hand, safe and sound, so that you've got, you don't have to go looking for everything when you've got a problem. You actually can just quickly respond and grab what you need. And just that list, as Jack said, the webinars are recorded. You'll get a copy of the slides, so you don't need to quickly write it all down. But I think if you've got a calving pack that's got a long rope I like a head rope. You can use little head snares, a couple of short chains or ropes. Often in on farm, I'll use straps rather than chains, and a good calving pulley or calving jack. as I said last night, people ask me what my favorite is. I like to use calving jacks on the farm, but I find them really awkward to travel around in my ute in my car, and so I use a calf pulley in my car because I also can use that for picking up feet, and I use it for putting hips back in and all sorts of stuff. The calving pulleys are incredibly useful piece of equipment. Really cheap. I think we sell them. I know a number of different people. I know Shoof sell them. That you can get them often from ship's chandlers because the idea is using the pulleys that we use for the calf pulleys. They're just from sailing boats, and if you buy all the bits and the rope, you can often put them together cheaper than what you can buy them already made. But you do need to have a little bit of a handyman about you. But having a calving pulley is a great addition to your tools. Obstetrical gloves and lube. I like to use long gloves. I like to put them over my shoulders. I do that for two reasons. One, it helps to keep the cow's reproductive tract clean so that I'm not as likely to be putting germs off my arms into the cow, but it also works the other way and it prevents the risk of some of those awful infections like Q fever and lepto that we can catch from the cows when we're calving them by putting a barrier between us and those calving fluids. I mentioned last night, and I'll mention it again. If you're not vaccinated for Q fever and you're assisting cows calving, ewes lambing, goats kidding, then you're kidding yourself. You really should be getting out and getting vaccinated for Q fever because whilst most people only get it as a mild sort of flu-like disease, some people get a very serious, quite debilitating version of Q fever. And being vaccinated is the only real protection against that. As far as lubricant goes, I saw one of the questions that came through last night that I wasn't able to get to because I ran out of time was about what lubricant do I use. And the lubricant that we use is just the general obstetrical lubricant. It comes in 5 litre buckets. You can get it as different colors, green, blues. The one I use is clear. There are some that have got preservative or benzalclonium, which is a disinfectant already added to them, which are great, but not if you're an organic farm because the organic farms can't use them. But just buying a commercial obstetrical lubricant, you can, as I say, buy it from rural stores, you can buy it from AI service providers, you can buy it from your vets. It's astonishingly expensive for what it is, but it's really valuable stuff. And often one of the things that I identify when I get called out to calvings is that I go out there and everything's dry and tight. And I just get a little bit of lubricant, get some lube over the top of the head, get that reproductive tract nice and slippery. And it's astonishing how big a difference that will make. And it's so good a spend of your money to get plenty of lube in there. We teach our young vets to use a glove where you can pour some lube into the glove. You put the glove inside the cow, break the finger off the glove, and then squeeze the lube out inside the cow so you get it down right where you need it. And so that's kind of a nice little tip. I talked to you last night about using a calf resuscitator. You can buy them again. They come. They got a suck and a blow version. You can suck all the snot out of the nose, and then you can turn it around and blow the air into the lungs. You've got to block the esophagus by pushing down on the left side of the neck as you ventilate them, and that can make a really big difference. And then I also in my calving kit have a couple of clean towels, usually a bucket with some disinfectant, my NLIS tags or my management tags, because I do like to tag a calf as soon as I can so that I recognize who it belongs to. And I love calf coats, putting on those high risk, weak, sick calves just to make them feel that little bit more warm, reduces their energy consumption so that they've got more energy available to grow, to put into their immune response and all that sort of stuff. And I think that spraying or dipping the navel in either a chlorhexidine or an iodine solution is a really valuable thing to do. We mentioned last night the signs of an impending calving, what the cow does, how she changes her behavior. She'll become restless, she'll isolate herself from the rest of the cows. And that's often the first thing that we'll see is a cow or heifer just off on her own. And keep an eye on them, like they don't necessarily need any intervention at that stage, but it's just giving us the hint that stuff's about to happen. We'll start to see the physical signs. Their udder will fill, or we call it bagging up. They start to develop that udder. they'll swell and soften. So they swell around the vulva and they soften around the tail. So the back end of the cow can become quite floppy. Again, referring to some of the questions from last night, someone asked me, how do we prevent cows from prolapsing? It's a really hard question to answer because you can prevent cows prolapsing by gentle calving assistance. And I'll almost always give a cow an injection of oxytocin or syntocin after I've calved her, just to get her uterus to contract down so that it's less likely to flop out. But often metabolic disease like milk fever, a prolonged difficult calving or a prolonged labour can weaken the muscles and just allow that uterus to prolapse out. That becomes a genuine veterinary emergency if you've got a cow with a prolapsed uterus, because the bits that are on the inside become on the outside, and it's terrible for them. They can, damage their uterus really severely and bleed, or become damaged. They can trap their bladder in that prolapse, which is a tragedy, or it just simply becomes dry and crusty and becomes non-viable, and you can lose the cow for that reason. The three stages of labour is stage one is sort of 3 to 6 hours up to 12 hours in heifers. It's when they've separated off, they're lifting their tail, they're swishing their tail around, they're maybe kicking at their belly. This is like, I'm on the job, but I'm not quite ready to push yet. They're up and down, so they might get up and lay down, get up and lay down. And last but not least, they'll have the presence of their water bag. And if that water bag sits there for a little while, it's not the end of the world. But I would say if a cow is in that first stage of labour and hasn't progressed after 6 hours, say, unless you see something obviously wrong, go for it and get her in and examine her. The second stage of labour is that's where the action's happening. That's the actual delivery. And I think that the key thing here is that 30 minutes to up to 4 hours, and heifers sometimes even will take a little longer. But what we're looking for is progress. The cervix by this stage is fully dilated. She'll often be straining. So when she gets up and lays down, gets up again, when she lays down, you see her pushing. She's got visible abdominal contraction. And she'll also break that water bag, and you'll often start to see the first signs of the calf. And in an ideal calving, and I'll say an ideal normal calving, you see feet and nose. And if you've got feet and nose and things are progressing slowly, and that might be feet and the tip of the nose and then the wrists and the bridge of the nose, and then halfway up the forearms, and it gets over the eyes. That slow progress over 20 minutes, 15 minutes, half an hour. If they're making that progression, then I'm not too worried, and I'm not going to disturb them. I'm going to leave them alone. But if they don't require assistance, getting in early at this stage and pulling too hard can do more harm than good. And so I do encourage people to use their discretion and use progress as the measure of success during stage 2 labour. Once the calf enters the birth canal and is expelled, then it's our happy days. And as I say, it's quite normal so long as there's slow progress. If things stop progressing and you've seen just nose and toes, nose and toes, nose and toes, and it's been going for an hour or two, and you've got no further after that time, that's when you'd want to examine her. The other time that I tell people to examine them, when they've got like that issues in this stage 2 or actual active labour, is if there's something obviously wrong. If the cow is distressed, the calf looks distressed, you've got crossed legs or one leg or just a head. If there's an obvious malpresentation, then you don't wait 2 hours. You would intervene more quickly in stage 2 of labour if things are obviously going wrong. And the stage 3, which people kind of forget it, it's kind of the afterthought, but it's the expulsion of the membranes passing the placenta. And if they haven't passed their placenta within sort of 12 hours, we consider that to be retained, and that puts that cow at a higher risk than average of infections in her uterus. And I always sort of say to people, if you've put your hands inside the cow, there's a really high chance, there's almost a certainty that you've introduced germs doing that. And so cleanliness is next to godliness. And so, in this picture here, we've got a person assisting with a dystocia. They've got some ropes on. They've got gloves on. They've cleaned the perineum of the cow up quite well. So that's been cleaned and hopefully disinfected. And so that's minimizing the risk to that cow by assisting her with her calving. I mentioned last night some of the reasons why a cow gets dystocia, and we're going to dig into these a little bit more later on. Excessive body condition score. A big calf or a small cow, weak or absent uterine contractions, the twisted uteruses, which are quite difficult to deal with, and an abnormal position of the calf when it's being delivered. And as I said to you last night, for those that were there, which ones can we control? And it's really only the first three: the body condition, the big calf, and the weak contractions that we can do something about. There's very little we can do about a twisted uterus or an abnormally positioned calf. Those things kind of just happen. So I talked about intervention, and I think that it's really obvious that the intervention, A, that we do, and B, that when we do it, will depend a lot on the experience and the judgment of the person who's there to assist. The reason why I push people in this idea of a 20-minute rule is that if you're doing something for 20 minutes and you're making no progress, you either find somebody more experienced, you try something different, you find somebody more experienced to help you, and if the worst comes to the worst, as I say, you call a vet to come out and make it our problem. I also think that the other thing that I encourage people to really, really consider, and I remind you all again, and I continue to remind people, is that we need to be safe when we're examining these cows. So the facilities have to allow us to make a safe examination of the cow and her reproductive tract. You're talking to somebody who's done dumb things like try to pull calves behind gates and farms with no headlocks, and so that you get crushed and kicked and all sorts of injuries. And it just is stupid to do that. And if I had my time again, I'd do things a lot more carefully. And so I would encourage people to only really intervene when the facilities permit that safe examination. We need a well-stocked calving kit, an adequate crush. I like 2 buckets of water, one that I'm working out of and one that I keep clean for making sure that I'm doing everything nice and hygienically as I can. Because if we just keep contaminating that reproductive tract, and I've been out to farms to assist calves, and the people have been pulling at that calf for a long time, and they've done all sorts of dirty things, and I put my hands in and there's dirt and grit and manure and all sorts of stuff actually inside that cow. And I think, oh, that poor girl, she's got very little chance of not coming out of this worse for wear. And so hygiene, cleanliness is next to godliness. I talked, and will continue to talk about this idea of assessing the size of the calf relative to the birth canal. And if you can fit your hands over the calf's head while you're pulling it sort of up with just hand strength, and you can extend the fetlocks or the wrists sort of out past the edge of the vagina or the vulva, you can usually pull those calves if they're coming forwards. A rear presentation, so the calf coming backwards, is a normal abnormality. But that's the normal abnormality of a calf coming backwards, is where the feet are presenting sort of upside down, both back legs are coming. And if you've got that thing and you can put ropes on those back legs and you can pull that calf so that the hocks or the pointy bit comes out level with the vulva when you pull. And if you can slide your hand in over the top of the pelvis of the calf, it's going to come out. And again, one of the questions last night someone asked me was around, calves coming backwards. You do have to be more quick delivering calves coming backwards, because they do tend to get because they're coming backwards, their umbilicus becomes compressed and will often tear off sooner than if they were coming forwards. So those calves, if they're face down in the the uterus, in the juices, and they're getting no blood supply from their navel, they'll start to gasp and they can aspirate, and we'll see sometimes these backwards calves come out and they do struggle a little bit with their breathing afterwards, because they've just had that really difficult time. People ask me, when should I call the vet? And I would always say, if you're unable to provide the assistance yourself, just call the vets. If the calving has been prolonged and you've done your best, and there's no shame in calling, and calling sooner than later. is the way to go. If you've got a cow that's been in stage one labor and she's done nothing, she's just not progressed, and you put your hand in, you can't find anything. There's no feet, there's no legs, and especially if you can't advance your hand into the birth canal because there's a twist or a torsion, you've got to call the vets to those. If you've made no progress and you've been pulling, you've been trying to get a leg up, you've been trying to get a head out, and you're just getting nowhere, don't just keep going without trying something different. If you've tried something different and you're out of ideas, that's when you call us. Because if we get out there while the calf's alive, it's a better outcome for everybody. It's better welfare. It's more profitable for you. One of the obvious reasons why people call us is if they go to examine a cow and they put their hand in it, it just stinks. So if there's an obviously dead, rotten calf in there, that doesn't mean you can't try and pull them out yourself, but a lot of the time people will ring us to do that, make it our problem. And the main reason why we get called out to calves is when you've got a relatively large calf compared to the size of the birth canal, and there's just no room. And in that case, there's a few tricks that we can do. If they're malpresented and the legs are back or the head's around, we've often got a few little tools that we can use. Plus some, we can give an epidural and some drugs to relax the uterus just to make that a little bit easier. The 20-minute rule I've mentioned a couple of times, and I'm going to continue to mention it because, as I said, my wife tells me she has to tell me things 10 times before I remember them. And so, this idea of just try a different approach. If you're trying to get a leg up and you can't get it up, try from the other side. If you're pulling on some feet and not getting the head to pull up, try putting a head snare on the head and then pulling that calf. If you're still doing no good, though, after 20 minutes of trying, get someone else to give you a hand. And this statement at the bottom of the page there is that pulling calves are trying to correct malpresentations for hours before seeking expert assistance greatly reduces the likelihood of successful outcomes is a polite way of saying that you're going to pretty much screw it up, and it makes the likelihood of a vet coming out and having a successful outcome much less. And so then you end up spending money unnecessarily because you get no good outcome at the end of it. Often we end up with a dead calf, a dead cow, a cranky farmer and a cranky vet. And so that's a pretty poor outcome all around. So now I'm going to start talking a little bit more about preventing calving problems. And this is kind of where I try and get people to think about, let's take a whole of system approach. The next slide I'm going to show you is a busy one, and I'm going to talk through it because it's a bit of a story that a veterinary colleague and a good friend of mine, his explanation of why, these problems occur. He said to me, a farmer can choose a poor quality bull and breed him with a poor quality cow. They do a poor job of managing that pregnant cow, so she gives birth to a compromised calf. That compromised calf with poor genetics gets fed and managed poorly, so she doesn't grow well. And then that heifer finally reaches puberty. She doesn't do it in an efficient way, but she finally gets there. And she's short of stature, small of frame. And then that same farmer breeds her with a bad bull, an inappropriate breed, or a bull with bad genetic traits, and then does not manage that heifer well, so she doesn't continue to grow. She gets smaller and smaller, relatively speaking. And because she's poor quality and been poorly raised, she doesn't really bag up because, there's no udder development. And so the farmer doesn't see her as being a heifer that's about to calve. So he leaves her well down the back paddock. And she's not observed when she goes into stage 1 labor. And when she fails to progress because she's got a giant big calf in her, relative to her size, she's not observed and she's not assisted to calve. And finally, after a couple of days, she's noticed off under the trees with a little bit of membranes hanging out, maybe a little bit of a waft of smell. The farmer tries to deliver the calf for a couple of hours. He waits until it's dark. He or she wait until it's dark because you'd never call the vet until it's nearly dark. And then they finally call us out. And somehow, when we arrive there, it's our problem. And we have to deal with it. And when there's a dead calf and a paralyzed heifer, somehow the vet didn't do their job well. And that kind of, to me, sums up the worst case scenario that we see when decisions are made all the way along. But if you think about that story, there are so many opportunities to do things better and do things well that will prevent calving problems. And so whilst I think we must expect the occasional difficult calving, because there are things we can't control. We can't control twins. We can't control these really bizarre malpresentations. Sometimes I wonder how on earth the calves get themselves into those positions. Our breech births where they're just a bum presenting and legs are forward and you can't prevent that. So we should expect a few. But if we can control the things we can control, then we know that we've got a systematic approach to preventing calving problems. So again, a question asked last night, and it's in tonight's presentation. What is normal, for abnormal calvings? And I would sort of say, if you have more than about 10 to 15% of heifers requiring assistance, or 3 to 5% of cows requiring assistance, then it's probably worth considering whether you should take a more systematic approach to preventing calving problems rather than just simply reacting to the disasters as they unfold. And sometimes it comes down to it sounds horrible, but accepting some of that responsibility that there are probably things that you could have done differently all the way along the line that may or may not have made a big difference to prevent that calving problem occurring in the first place. And this is where we talk about HACCP. In food safety, it's a really, really well-known concept. And HACCP is a sort of a short acronym for hazard analysis and critical control points. And that's what it means. We analyze the hazards, and then we think of where are the critical points where we can control the risk of that hazard, occurring. So each step of the process from beginning to end is looked at from a system-wide sort of view, because we're trying to say, what are the risks? What can we eliminate? What can we mitigate? So if we can't eliminate a risk, we can mitigate the risk. We can do some things to make it less likely. And if we can't even do that, we can often manage those risks. And so that's where careful observation would be an example of managing the risk of calving problems, because we can't necessarily always eliminate or mitigate, but we can do a good job of observing. So the production of a live, healthy calf is actually almost exactly like a food safety HACCP program, because everywhere along that line, if we do our things right, each time we're reducing the risk of a bad outcome. So every time we choose good genetics for our animals and we mate an appropriate bull over an appropriate animal to get a calf that we know is going to be, a more easily delivered calf, then we've done something systematically to reduce the risk and we've controlled one of those risks. So where you've got a really high incidence of calving problems, as I said, more than about 10 or 15% of your heifers requiring assistance, or 3 to 5% of your cows, you've got to start looking at it and saying, is there something like, is it my genetics? Is that what's causing my problem? Am I doing just a bad job of choosing which bull to put over which cow? Is it my early life management? So is it the way how I'm managing my baby calves, getting them to ensure they're getting enough colostrum, making sure that they're being reared adequately so they're growing at that sort of 0.6 to 0.7 of a kilo a day at least, so they're making we want them to calve at around 90% of their mature body weight as a 2-year-old. So if you think about that, they've got to consistently gain weight every day. And so that early life management and the nutrition and feeding management is a really important part of getting our calves to become the next generation of cow, growing their frame so that they're not stunted, runted little things with pot guts, that they've got a nice big open frame. We've got the bigger pelvic canal as we can possibly get. We've got lean growth in their early life so that they develop, plenty of udder tissue, so they're going to become a good mum. And we just want to make sure that they grow on that steady trajectory. They're never too fat, they're never too thin. We get that Goldilocks moment where we get things just right. disease in our young stock and in our cows can have a really big impact on calving. We see these animals that have got diseases or parasites, and the reason why they're failing to meet their growth targets is because they've either had chronic respiratory disease, chronic scours, they've had parasites, worms, fluke, and that's meant that they just simply haven't had the energy to put into growth, and so they've failed to hit their targets. If they don't die, they often will gain the weight, so they get sufficient weight to catch up as far as their body weight goes, but they never grow their frame. And that's the impact that has the biggest impact on their ability to calve as an adult animal. And then the body condition score. I talked about it last night. I'm going to mention it again here now. Body condition score is really important. If they're too fat or too thin, we really will struggle to get that cow to deliver a live, healthy calf. Maintaining and managing the body condition of our cows so that if you don't know what the body condition of your cows is because you're not familiar with the system, dairy cows will use an 8-point system, beef cows will use a 5. You can go to Dr. Google and Google it. There's some great resources online about how to do it, or find somebody like a vet, a consultant, a nutritionist who can come out and help you to work with you, in your pasture allocations, in your supplementary diet sort of programs, so that you maintain the body condition just in that just right range of about, for a dairy cow, 4.5 to 5.5, for a beef cow, sort of 3 to 3.5, so that they're not fat, they're not skinny, they're just like elite. They're doing what we want them to do. And then probably one of the last couple of things that we talk about when we're talking about looking at the possible factors as part of this hazard analysis, of where we might be going wrong, is our calving supervision and management poor? Are we doing a good job or a bad job of that last 2 or 3 weeks, or the last, critical few hours even, when the cow is getting ready to calf? Are we observing them? Have we done the hard work to get those animals comfortable with us walking through them, riding through them, in a side by side, or driving through in the ute, just so that we're able to observe them, so that we are able to notice those subtle differences, those stage 1 labor changes, the heifer or the cow that's off, on her own. She's separated herself and isolated her. And that also is in part of this cow health argument. Like if you haven't got them fit and healthy, if they've got chronic respiratory damage, so they've had bad lungs, and they're stunted, runted little things, if they've got pestivirus and they've got PIs running around everywhere, shedding virus, so you've got a whole bunch of immune compromised animals on the farm, you can't expect to have a good reproductive outcome in that circumstance. And so managing the health of the cows and having a good organized and coordinated herd health program is really quite valuable. So the sire, the bull, he has a really important role to play, because he influences the size of the calf, which obviously influences the risk of dystocia. But also, if you're using a bull to breed replacement animals as well as steers, so you're going to retain the heifer portion of your breeding outcomes, you also need to make sure that the bulls that you're using are not just going to be low birth weight, but also are going to leave cows that has breed heifers from that bull that are going to have easy calving. Sometimes you have people that just will say, I'm going to put, say, a Jersey bull over my Holstein heifers for the first time just so that I can get easy calves out of them. But then you miss out on an opportunity for genetic advancement, because your heifers theoretically should be your most genetically advanced animals on the farm. And so you're actually giving away a whole generation if you're making breeding choices around convenience rather than actually looking at what genetics might fit that gives you an animal that's going to be a good breeder herself, but also likely to be an easy calving bull. So I said earlier that the disproportionately large calves increase the risk of dystocia, and that the appropriate selection of a sire using calving-ease bulls will help to eliminate this risk, especially in your heifers. If you're selecting bulls or genetics that have extreme calving difficulty or heavily muscled bulls, these some of the European breeds of beef cattle that are, very muscular, high birth weight animals. That's fantastic if you've got everything else going right. But I see, unfortunately, circumstances from time to time where animals that are not going to be well supervised, sometimes owned by hobby farmers, people that are not got good facilities to handle these animals and manage them if they run into trouble, and they don't have good calving management skills, but they're attracted by the idea of, these incredibly impressively muscled animals. I've seen some real disasters with that. So I do think that you've got to match your bull to your supervision and your calving management skills that you have available to you. Last but not least, the use of short gestation length bulls is a really good way of you shorten up the gestation so they're smaller calves, and so you'll if you're looking at a terminal sire, and if you've dropped the ball, like, and your heifers are a little bit undersized, and you think, oh wow, I don't know whether I'm going to just try and grow them out for another year or I can join them now. You might choose to use a low birth weight or a short gestation bull over those heifers, just so that you can get a calf from them this year, because empty heifers are costing you money every day and that they're not productive. When we start talking about these estimated breeding values, which is what EBV stands for, there's a couple of ones that are relevant. The first one that I really like people to think about and focus on if they're looking at, catalogs of semen, to pick over what bull they're going to put over their cows or their heifers, is the calving ease direct. And that calving ease direct is a basically it's a difference in the percentage of unassisted calvings from that bull's calves. And so it's a particular bull's calves. So the bull that you're choosing, how easy are his calves going to be born? And so the more positive, so the higher the number, the calving direct ease EBV is, the more favorable it is. And so, for example, if you had two bulls that you were looking at, and one of them was a calving ease direct EBV of +6, and the other bull was a calving ease direct of 0, so he's about average, and the other one's +6. You would, on average, because averages are just what they are, on average, you would expect the bull with a +6 EBV to have about 3% less difficult calvings from 2-year-old heifers than a bull with a calving ease direct bull of 0. So that 60% difference between the 6 and the 0 is halved, because pretty much the bull only contributes half the genetics. So just focusing on calving ease direct will give you about half the impact of what the positive impact of that bull will be. So then you think to yourself, okay, what can I do from the other side of the equation, from the mother's side? And the calving ease daughter EBV estimates the genetic difference between bull one's daughters to calve versus bull two's daughters to calve. And so the higher the calving ease daughter EBV is, then that heifer that you breed and use as a replacement, she is less likely to have problems than a heifer that's been bred from a bull with a low calving ease EBV. So the calving ease daughter example that I'll give you is similar. A calving ease +4 versus a bull with a -4. The bull with a +4 EBV for calving ease daughters, his daughters will have less problems as 2-year-olds than a bull with a calving ease daughter of -4 or 0 or whatever. So if you're only breeding animals to sell for slaughter and you're not keeping them as replacements, the calving ease daughter is not important to you, because you're just culling those animals. They're going to be sold. So the calving ease direct EBV, which is actual impact that bull is going to have on the next calf, that's important to all beef producers, because it's the best estimate we have of what impact that bull will have on the next calf to be born. Whereas the calving ease daughter EBV is important, probably in some ways more important, to the people who are retaining daughters in their own herd. Okay, so over several generations of selection, if you made a decision today and say, we are only going to use positive calving ease daughter bulls going forward, and even maybe push it to the upper limit of what's available. So we're really actively going to select for calving ease daughter EBV. Over a few generations, you will see your dystocia rates slowly falling by, as I say, about half the bull's rate to improve that. And so whilst it's a slow progress, it's a progress. And I do think that when we're starting to talk about herds with high incidence of dystocia, it's one of the strategies, but it's certainly not the only strategy, because it does take some time for that impact to work its way through the herd. So we talked about this dam stature, the size of the mum. We've got a vastly increased risk of dystocia in poorly grown, small, tiny little heifers. We see the heifers that accidentally get in calf too young. They might have been, rogues, jumped a fence, the bull got in with them and nobody noticed. And they're just, awful experiences for everyone involved. And I also say to people, if you're buying heifers, buyer beware. Ensure that if you're buying replacement animals that are not meant to be pregnant, get them preg tested before you buy them. Buy them preg tested empty, because the number of times over the years that I've been called out to a heifer that's calving, and the farmer says to me, I didn't even know she was pregnant. We bought her through the yards, and they weren't meant to have been mated. And you've got a 19 or 20-month old heifer that's only 3/4 grown, trying to deliver a calf, and it ends up a disaster. I said earlier, we want to get our heifers calving at that 600, 90% of a mature cow. So 550, 570 kilos if the mature cows are 600 kilos. And not many heifers actually achieve that. And if your heifers are not achieving that, there are things you can do. As I said, it's parasite management, it's disease management, it's nutrition, getting support from somebody to help you with their nutrition program, regularly weighing them to maintain that growth trajectory, so you know where you're at. If you're falling behind, it's almost always cheaper to supplement animals to get them to where they should be than to carry them longer or carve them out of season. So if you end up, you normally would carve in the spring and you want them to carve as 2-year-olds and they're not making their weight, supplementing them to get them there as young animals by weighing them and knowing you're falling behind is way more economical than it is just simply letting them go and saying, oh, I'll carve her next year as a 3-year-old, because you've carried her for a whole year empty. Or sometimes even worse, deciding to carve her when she catches up out of season. So, you might not have the pasture availability or the feed availability, so that you create another generation of poorly grown, underperforming animals. So, our heifers that have had disease setbacks, and we see this a lot in our dairy animals now, the heifers that have had pneumonia that are just never quite, I call them NQRs, they're not quite right. They just don't get to where they need to be. And they calve late, and their calves are late, and so then their calves are late, and just you can actually get yourself into a real cycle where you're actually breeding poor outcomes. And so often I tell people the first loss is the best loss. And if you've got an animal that's clearly not going to meet its targets and it's not going to get there, whether it be from pneumonia, whether it be from parasites, or something you've dropped the ball on, sometimes you're better to cut your losses on them, and then sort of compound your problems by continuing to try to chase that mistake. Parasites are they're an ongoing problem. I shouldn't even say an emerging problem, but resistance to anthelminthics, drenches, is a real issue. If you currently don't have a parasite management plan for your animals, it's a really good idea that you talk to somebody, ideally a vet, who can help you to create that parasite management plan. Regular worm egg counts. Worm egg counts are really cost effective, because they serve two purposes. If you do a worm egg count on a group of young animals and you find that they have high worm burdens, and then you drench them, and then 2 weeks later you test them again and you find out that they still have high worm burdens, we know that that drench was ineffective. You may have used a poor chemical choice. It may be that they're simply just resistant to that chemical. And so a worm egg count is not only going to tell you whether you need to or don't need to drench, but it also can give you that information as to whether the drench that you have given has been effective. Because of the widespread use of pour-on single active mectin type drenches, there's widespread resistance to that group of chemicals. And so on some farms, they still work really, really well. But on other farms, you have a false sense of security because you say, oh yeah, I'm drenching regularly. I drench them every April and I drench them every August and I follow up with the summer drench and I do all the right things. But if that drench is ineffective, you've wasted your time, your money, and your animals still are not getting the benefit. So they are losing their growth potential, which means that they're not going to be as big, their frames aren't going to be as open, and they're going to have more dystocias as calving 2-year-olds. And so it's those setbacks from things like parasites that can really have quite a significant impact on the likelihood of dystocia happening when they do finally calve in as a 2-year-old. So I always tell people spring, summer, and autumn. It's not a bad time to think about drenching, but I emphasize this idea of an effective drench. I like injectable dual actives or orals with multiple actives. Some of the triple active sort of orals are my preferred drenches. And we could do a whole webinar on just drenches and drench resistance, but they're probably people better and more educated than me to talk to you about it. But ultimately, we want to do worm egg counts, test for fluke, do all those sorts of things, because we need to know that if we aren't drenching, whether we should, and if we are drenching, whether it worked. I think that's really important. Preventing disease and the ones that the real cool diseases like pestivirus or BVD, we should be preventing that with testing, surveillance, and vaccinations. Lepto shouldn't be an issue in our cows because I'd really like to think that everybody is doing at a minimum doing lepto in 7-in-1 vaccines to prevent the risk of lepto in the cows, but also in the people, because leptospirosis is another important zoonotic disease. And then the disease vibriosis or Campylobacter is a reproductive disease. It's basically like the VD of bulls. It's a venereal disease of bulls. It's spread. It's usually introduced into a herd by a bull. So the bull comes in carrying that bug and then spreads it around. And it can have a devastating impact on the fertility of the herd, particularly in the first year when it's introduced. And I wish I didn't have to talk about it because if all the bulls were vaccinated, we want to test our bulls to make sure they're producing quality semen. We want to make sure that they're not a pestivirus carrier and that they're vaccinated for pesty. They should be vaccinated with 7-in-1 and vaccinated with Vibrio to make sure that they're not going to be the contributor of diseases spreading on your herd. Managing the diseases that affect calves in their early life, things like scours and pneumonia, are the two really important ones in young animals, and respiratory disease in weaners, pink eye in weaners associated with immune suppression, and all those diseases that occur that give them a significant setback can really have an impact on their growth and their ability to reach their potential when we want to carve them in as a young adult. Abortion in animals. So if you're seeing cows aborting, I would always encourage you to, if you get anywhere near 2% of the cows that you've got aborting, then you definitely should be getting that investigated. You probably in Victoria, we should be getting what's called an SDI or a significant disease investigation done so that we can rule out some of the important causes of abortion. But I also say to people, if you're lucky enough, and I shouldn't say lucky if you're unlucky enough, to find a fresh, undamaged fetus, so it hasn't been preyed upon by foxes or dogs, and and sometimes you even still find them inside the sack. Those are the ones that make great lab samples. We can often get a diagnosis from those, good fetuses, a little bit of membrane, some blood from the mum, and we'll often end up getting a diagnosis. And I'm a big fan of making diagnoses because it's really hard to prevent something if you don't know what it is, and it's harder to treat it if you're only guessing. And so far too often, we recognize syndromes, things like pneumonia or scours, but we don't go the next step and create the diagnosis, or make the diagnosis as scours caused by salmonella or pneumonia caused by Mannheimia, so that we can actually put in place those preventative strategies that are so valuable as part of this hazard analysis type thing that I'm talking about, where you're doing, it's hard to believe that preventing disease reduces the risk of a cow having trouble calving. But if you're looking at the whole system, it's one of the best ways we can prevent calving problems. The body condition score I mentioned earlier, we said that if the cows are really fat or really thin, that they're going to struggle. And the really thin cows are too weak to calve. And we see this occasionally in animals that are carrying, say, twins. We see it in really old cows that teeth have gone on them, cows that might have been lame or something like that. And obviously in drought conditions, where feed is limited. Now, these cows can develop a syndrome which we sort of associate with lack of energy and low calcium, and this whole issue is very hard sometimes to turn around. And so ideally, people ask me, how do I treat these cows that are down? And we can give them fluids, and we can give them some, ketol or propylene glycol, which is like an energy drench. We can give them some calcium or 4-in-1. But that's kind of like putting the band-aid on after the disease has progressed past the point of no return often. And so these pregnancy toxemia animals, as we call them, the best thing to treat preg tox with is not to have to treat them. So you prevent them by don't allow them to become too thin. If feed availability is the issue, then if you can't source quality feed and you've got pregnant cows, you need to consider whether you should be exiting those animals. And if you've got animals that are failing to thrive, and they might have, God forbid, yonis, or they've been really lame, and so they've become very thin, or they've lost all their teeth and they can't graze, culling those cows is the only sensible option, because I can't prevent a dystocia in a cow that's just so weak that she can't do the job for herself. And so you're much better to try and prevent them from getting to that stage in the first place. Our big fat girls, our really fat girls, can have a fat pad that I've seen one that come out that was as big as my head, that was just this big blob of fat that was physically blocking up her birth canal. That's extraordinary when they get that fat. But sometimes managing fat cows is just as hard as preventing fat cows is as hard as preventing thin ones. If you end up with a real flush of feed, we sometimes see it in herds of cows, that the cows that are calving late, so they didn't get in calf early and they're calving later in the calving period. We're well into September in our spring calving herd, and the feed has just gone crazy by that stage, and you'll see cows laying down fat really rapidly. So monitoring and maintaining that body condition by restricting access to feed, maybe providing some hay rather than just ad lib high quality pasture, just in that last little bit, so that we make sure they're not just grossly obese, is a really important part of managing body condition score. The transition management and feeding in our dairy cows, we do this really well. Most farms now we call lead feed. They feed a low potassium forage, like good quality hay. They'll use an ionic salt, or maybe even a phosphorus calcium binder, something to sort of mobilize body calcium, so that we reduce the risk of milk fever. And so low calcium in the blood cause milk fever. The uterus is just a big muscle, and if they can't contract to stand up, they also can't contract to squeeze the calf out. And so that's often why we'll see cows down with milk fever right on the point of calving, and we see it a lot in our first cross dairy beef mums. So our Baldy cows and our Angus Friesian cows, those first cross dairy mums, some of them get milk fever right at the point of calving, and the calf will just be sitting there waiting to come out. And it's just that they don't have that calcium which is required by the uterine muscle. And if they don't have that calcium to cause the uterus to contract, then they won't progress their stage 2 of labor. And you know, this management of the transition diet, there's vets, there's nutritionists, you've got herd, management consultants that can help you if you're not quite sure as to where you are with that. And it's a really valuable tool in reducing the risk of calving problems. The idea of calving supervision, I don't think I can emphasize this enough. It's probably one of the areas where you can have done everything else right, but if you drop the ball right at this, it's like fumbling on the 5 yard line. You've got right there, and then you just drop the ball at the last minute. Believe it or not, and of course, being a vet, everyone always says, "Oh, of course, you say preg testing is important." Preg testing early is one of the most valuable tools that you can have available to you. Because if you've got an absolute joining date, so if you've got an AI date and then you've got a confirmed pregnancy to that date, and if you're not using AI, if you're using bull matings, if you've done an early pregnancy test, so the accuracy under about 14 weeks of pregnancy is usually plus or minus 1 or 2 weeks. So, that idea that you can be within 1 or 2 weeks of when the cow is due to calve or the heifer's due to calve means you know when to bring her up, keep a good eye on her, start to observe her, look for the signs. Because the normal, and I call it normal, the normal gestation of a cow is around 282 days plus or minus 10. And they think, okay, so that means anywhere between about 270-ish, 272 and about 292 is about sort of in the normal range of what we would expect. And then if our preg test is 1 to 2 weeks out, it could be 1 to 2 weeks either way. So you still are talking about a range of up to a month of variance around the due date of when a cow might calve. But that's a hell of a lot better than having a way down the back paddock with no idea when she's due to calve. And I talked about it earlier, and I'm going to talk about it again. One of the things that people can do that's really positive, an incredibly positive thing that you can do to reduce your risk of dystocia, is to make sure that your cows are very comfortable with you. And that means being amongst them often enough so that when you go into the paddock, whether, as I say, whether it be on foot, whether it be on a bike, whether it be in a vehicle, remembering if you're going in on foot around calving cows, be careful because sometimes the really friendly ones will still decide to try and eat you. But if you need to have those cows comfortable with you walking amongst them and observing them, because if you can't do that close supervision, if you can't do it easily, you won't do it. Human nature being what it is, if every time you go to the paddock they run to hell away and you think, they're all fine, so you don't observe them, and then by the time you do find out the problem, you've lost the calf and maybe you'll also lose the cow. And so this is, I suppose, the challenge for everybody, and it's something that you only learn with experience. And so there's no easy thing I can give you that just will suddenly make you great at getting the balance between sufficient supervision and intrusive intervention. Getting that balance right so that you're in the middle does take skill and experience. It really does. And so the only way you get better, though, is by observing and just learning. And if you use the guidelines that I talked about earlier, if you use the suggestions, and I'll bring the slide up again around when to intervene. If we use these as our guidelines, our rules, then over time we will learn, and you do become much more skillful. And I do emphasize again, lots of people are injured around calving time, trying to assist with calvings if the facilities aren't good, if the animals are wild. I always remember a scenario I went to once, and the old farmer, he was a really old guy, and he didn't move real fast, and it was really boggy, and he got stuck in the mud, and this calving cow ran straight over the top of him, and I thought, gosh, he's got to be dead, but he wasn't. He was luckily all right. But just the facilities were poor. The mud was shoulder deep nearly. It was so muddy, and these animals were wild as March hares, and so he'd done everything wrong to try and have a safe situation where we could intervene and do a good job. So socialize your animals well, particularly on small holdings where the facilities often aren't great. Having animals that we can easily catch There's no point calling the vet out if the cow's over on the way on the hill. She's got to be in the yard, ready to go, because that's one way to make us very, very grumpy, is to call us out and then have us chase cows for an hour. But if you're able to get them in and have them well socialized so that handling and movement becomes really important, really easy, then I think that's important. We talked a little bit earlier about resuscitation, and I say to people, often the farms are more likely to deliver the calves that are going to need resuscitation because you're just there on the spot. Like, most farmers deliver way more calves than vets. We get the difficult ones, and a lot of the times ours aren't up for resuscitation by the time we're dealing with them. But having the ability to look at the type of the delivery, is the calf full term? Is it mature? Is the calf like vigorous? Does it roll up onto its sternum? Is it floppy and just weak? Those sorts of things really play into the value of resuscitation, because if you have a calf that's valuable, so it's either genetically valuable or money valuable or just valuable to you, there are some things we can do to help resuscitate them. We can give some bicarb and stuff like that. But often, assisted premature calf that's weak and non-responsive, that can't or won't roll into sternal, and it's just doing no good. Those poor calves, we probably really are throwing good money after bad. And if the mum is really unwell, and then she more is aborting than calving, then those calves are frequently not going to do well. And so, we can mechanically ventilate them. We've got these little picture of the commercial resuscitators here. I think they're kind of cute, but again, I don't know that they're that useful in some circumstances. But we do, if we are going to use them, you can see in the picture. Hang on, go back to the picture. You can see in the picture how the vet there's got his fingers holding the left side of the neck to constrict the esophagus so that the air is getting pushed into the lungs, not just simply blowing up the stomach. Yeah, and as I say, one end sucks, one end blows, and they're quite useful, but I wouldn't necessarily always recommend people have them in their kit. I'm going to just briefly now, and I'm going to briefly talk about humane euthanasia of calves, because we get the occasional calf that, as I say, is non-viable, and if there's uncontrolled pain or suffering or lack of treatment options, we do need to make sure that we're going to euthanize things promptly, safely, and humanely. And it's got to be prompt for the animal so that it doesn't suffer. It's got to be safe for the animal and for us, in as much as we're not going to damage other things. And it's got to be humane. And the only sort of four options we have, and I think the last one's a terrible option, is the first one is we can use a firearm. The only problem with using firearms, is that you've got to have a license, and you require, all of the requirements around storage and handling. And, there is a risk associated with having guns because they fire a projectile. The second option is use a captive bolt. And if the people are not familiar with a captive bolt, you can buy them without a license, and you don't need any, there's no requirement to, even in Western Australia now, you can just, you can buy one from the Shoof catalogue kind of thing. We sell them as well. But look, I would not use one without being trained. I wouldn't recommend it. The idea of euthanizing chemically, using barbiturates, vet only, the big problem with us putting animals down with lethobarb is that you've got to then dispose of that carcass, because they can't just get sent to the knackery, and you can't just leave them out, because if something else eats them, it will kill them. And this idea of blunt trauma, it's still legal only if they're under 24 hours old, and only if there's no other alternative option that's better available. But the idea of bludgeoning something to death, I think, is a terrible idea, and I find it incredibly hard to even leave it in my presentations, because my view is that we shouldn't be doing it. If we're going to do it in a calf, we should aim between the ears. We used to talk about going eyes to ears, eyes to horns, and eyes to horns, and go in the middle. But it's much easier now. I just recommend people line it up between the ears and shoot down sort of towards the base of the brain. And if you can't get it at the front, you can also go in the back at the poll, and we're basically angling down from the poll right in the midline, to try and take out the brain stem. which is the bit that's important. So, again, I do think you probably do need some training if you're going to do that. But I do think that every farm should have access to the ability to prevent, say, a calf that's born with a serious deformity or something really awful. Don't leave it to suffer. There's nothing worse than as an industry and as just a humane thing to leave those animals to suffer unnecessarily. So I'm going to quickly wind it up. I've gone a little over my hour tonight, but I'm going to wind it up so we've got some time for questions. So if people have got some questions and want to start putting them into the chat, I've addressed some of the ones from last night, but there'll be surely others. Realistically, it comes down to no matter how well prepared you are, and no matter how much of this preventative stuff you do, there will still always be some cases that require assistance. But if you have accurate calving due dates, and you've got a herd that's comfortable with people walking or moving around them that allows us to supervise the calving cows, we can dramatically reduce the impact of these occasional but unavoidable problems. Okay, so that's the first part of it, is proactive care around ensuring that when stuff goes wrong, we've got the facilities and we've got a herd of cows that are comfortable enough to allow us to supervise them adequately, and when they are in trouble, get them in a way that doesn't add more troubles. But if you've got a real serious problem, like a systemic problem with calving problems, more than that sort of 10 to 15% in your heifers, more than that 3 to 5% in your cows, then I do think rather than just continuing to say, oh, we're just going to keep pulling 25% of calves every year, I really do think that you have to take a whole of herd approach. You need to look at your genetics. You need to look at your disease control, parasite control, how well you're growing those animals out, what their nutrition is, what your herd management is that's potentially contributing to that problem. Because if it's more than about that 10 to 15% of your heifers having troubles, it's a system-wide issue that you need to address, because it's not sustainable to continue to pull more than that number of calves, because it'll mean that next year you'll be doing the same, and the year after you'll be doing the same, and the year after you'll be doing the same, and it just makes the whole process unprofitable and unpleasant. Monitoring your growth rates of your calves, I do think is incredibly valuable. Scales these days, if you put the value of a scales and compare it to the value of just one beast at the moment, you can buy a pretty decent set of scales for the value of one animal. So if you think about it, if you're weighing your animals and you're checking that they're on target, you're making sure your heifers are growing at the rate that they need to grow to reduce the risk of calving, and you can reduce your dystocia rates and your dead on arrival rates from 15% to 10% or 10% to 5%, that those scales are free. Like you've basically paid for them in less than one season. So do think about that, or use a service provider that's able to help you to monitor the growth rates and monitor the body condition, to making sure that you're going to get those good results. And then last but not least, calving cows with good hygiene, gentle handling, and a degree of skill and finesse that's not just simply a case of hooking on and reefing out. You want to allow things to stretch. Time is your friend. Progress over 20 minutes is good thing, and making sure that you're not causing more trouble than you're fixing. One of the questions again from last night that I saw come through late was around what do you do for the torn calves? Well, torn cows, where you're delivering the calf and you tear. Some cows will tear, sure, but we have some farms that get way more than their share, and it's usually because they've either done one of two things. They've started too early to assist, so they didn't allow the cow to progress through her labour sufficiently. They've pulled too early before everything was relaxed. And the second reason is usually they've not used enough lubricant and they've been too rough. If you're just jacking them out, reefing them out, and you're tearing them, and you're doing that more than once every blue moon, like we have calves that we have to pull, and we've got even some that we'll do episiotomies and cut to get out. It happens, but if you're seeing more than the occasional torn animal around calving time, that gentle tissue handling, the gentle, like I think our female vets are much more gentle at delivering calves than our male vets, and especially the ones who've had babies themselves. And I do think that's a good place to start. Is that if you imagine that was you in that cow's position, would you want to have someone with filthy hands, grit all over them, no lubricant, hook on, and reef it out with a four-wheel motorbike? If you think that's appropriate, then you're probably in the wrong place and you're in the wrong industry, in my opinion. And based on that, that's sort of where we're going to end up the presentation. Sorry, as I say, I went 10 minutes over my time. We've got 20 minutes for questions. I'd love for you to ask me some questions if you've got some.
Awesome, Rob. Thank you so much for that. Great presentation. So, yeah, we do have a few questions here. So, keep sending them through. We've got a bit of time to get through them. So, we've got one here. So, they do all their vaccinations in preparation for calving and getting females in calve. Do you value vitamin A, D, and E and multivitamin for those
Yeah,
cows?
great question. Do I value them? Short answer with multimin and that sort of thing is that if they are deficient, it makes a massive difference. But if they're not deficient, it probably doesn't make that much difference. And so the great thing about multimin, though, is that there's some reasonable evidence around it that it if you give it at key times of high risk or high demand, so joining times, vaccine times, then if there is a mild deficiency, then you get a very big bang for your buck with those. That said, if you've paid good attention to their nutrition and you've got them growing well, and you know from maybe some surveillance, whether that be blood or liver biopsy work, that you're in an area that is not deficient or is deficient, then I think there are better, honestly, I think there are better ways of supplementing for truly deficient animals than, say, a multimin. But that said, I still use it myself. If we've got areas of high risk where I want to make sure that the animals are in their best shape possible, it's a relatively innocuous way of doing it. The vitamin A, D, and E, I say that if you have alpacas as part of your herd, flock, whatever you want to call it, all alpacas should get A, D, and E. That's a general rule. Far as cows go, it's an antioxidant. The vitamin E component of the A, D, and E is can almost sort of interchange with selenium. And so if you've got selenium deficient animals, then they'll often benefit from A, D, and E. But if you've got adequate selenium supplementation or an adequate selenium intake from their diet, then there's probably no giant benefit to ADE. Again, I still use it occasionally just because it's relatively cheap, and it's the ideal way to use those supplements is to test and prove that you need it, but I know why people don't.
Awesome. Speaking on that, actually, someone's asking about blood tests and will they give a status on blood calcium? And yeah, if so, could you basically summarize the best way to manage calcium pre-calving?
Yeah, again, a nice question. The calcium, it's what I find astonishing is that like the total amount of calcium circulating in a cow's bloodstream is tiny, like it's like 5 grams or something ridiculous circulating her entire bloodstream. So there's like just a tiny little margin of where it should be. And the cow does a pretty good job of managing that. Now, most cows, in fact, almost all cows, their calcium level will drop right at the point of calving. And so if we're testing them right on the brink of calving, we'll often see low calcium at that point. But if it's not associated with any clinical disease or issues, then it's hard to get too excited about that. In our dairy animals, we rather would take an approach of preventative management of calcium, whether it be with anionic salts or as I said earlier, some of the stuff. There's one called Exelit that's a phosphorus calcium binder, and we sometimes screen those animals with blood tests. We can collect bloods and look at where they're at, and see whether their blood levels have dropped and then returned to sort of where we want them to be. The value in blood testing cows that are down. If a cow is down, I often will grab blood from her before I treat her. Then I give her calcium on the expectation that it will make her better. And if she doesn't get better, I'll often test that for calcium, magnesium, and phosphorus, because they're the three of the metabolic problems that we see in those recumbent fresh cows. So the short answer is that we do some surveillance. we often would find that if we're seeing a lot of milk fever in a herd, we would go for a preventative strategy rather than a blood test and supplement. We would try and prevent with either anionic salts in a lead type feed or with a supplement of magnesium. You can use magnesium oxide on hay. You can use magnesium in water using a Peter dispenser. There are some ways that we can actually prevent low blood calcium levels in those transition cows. It's probably easier than blood testing individual animals and then trying to treat them off the back of that. That said, we also use fresh cow drenches that contain calcium propionate, and we use like calcium chloride gel, like it's like a basically a drench with like a bottle full of that stuff. And we also can sometimes use the boluses of calcium if we've got a high incidence of milk fever in a mob of animals, and we're not able to quickly and easily manage that. But yeah, blood testing down animals to try and quantify whether it is calcium, magnesium, or phosphorus is certainly worthwhile.
Awesome. There's a question here kind of on eating grain, so probably on the lead feed, like how they have the everything in there that they think they need to feed the animal and stop getting milk fever, but they're not eating it as well. So how would you increase the paddle, like, yeah, how
Palatability of
like
it. Well,
eat
that's
it?
one of the things about anionic salts. So the stuff that we often put in lead feed, that is to try and basically acidify the cow. Those salts are very unpalatable, and so the cows don't like the taste of them. So if you're feeding a grain mix to try and prevent milk fever and it's filled with it's got high levels of anionic salt and the cows won't eat it, there are some appetite stimulant things that you can put in there. I think there's one that's apple flavored. There's a few other different things that it's a case of talking to the feed company. They can sometimes add some flavor enhancers to that grain mix. Other thing you can try doing is pelletizing it. Sometimes feeding a pellet, if the cows are used to eating pellets and then you offer them a grain mix or vice versa, they'll just refuse it. And then realistically, most cows that are on a lead feed are probably only getting 2 to 3 kilos of that grain mix at a time. And so you can spread that feed like well, we've got some dairy farms now putting that grain mix into a mixed ration so that it's sort of more hidden, like putting the broccoli under the meat for the kids kind of thing. You're trying to hide the lead feed in it. But yeah, I would sort of suggest that if they're not eating their 2 to 3 kilos that they're meant to be getting, and they're not getting the benefit of the alkalinization or the anionic salt effect, then what we really need to do is look at the presentation of the ration rather than necessarily the volume of it. And it might be a case of, as I said, flavor enhancers or another way of presenting it to them. Because most cows will eat it because it's only a small amount, even though it's pretty awful and unsweet.
All right, we got a question here about they got a herd of beef cows. So what age should you start offloading beef cows, or how old is too old before you start having issues? So is there an answer with that, or is it just based on the outcome?
Yeah, there's no hard and fast answer. Cows left to their own devices can live 15, 18 years old. Like a lot of the time, the reason why we end up culling beef cows or any cow for that matter is that they just simply become less fertile and less productive as they get older. Things like their udders get lower, they get more issues, they might get more chronic feet problems or eye problems. We've got to check their teeth. You see the old cows that are really struggling when the conditions get a bit tight. And often we'll mouth those cows and they've got bloody broken mouths, only 2 or 3 teeth left in their head. And because they don't have top teeth, if their bottom teeth are no good and they've lost a few of those, that can be a reason why a cow gets culled. Often the reason why we cull them for old age is just simply they failing to conceive or they're failing to perform. There's no hard and fast. At 9 years old you have to get rid of them. That's just not true. Usually they're culled based on their failure to be productive, and that's usually with reproduction, or they've accumulated or developed a chronic illness or disease, whether that be lameness, mastitis, something like that. But I would suggest to you that probably failing to conceive in those older cows is one of the common reasons. And then Genetic advancement is another reason why we cull old cows. If we're using, if you've got a beef herd and you're using, good bulls and you're breeding better animals each year, unless you're lucky and you've just got an unlimited source of wealth to just keep getting bigger, you've got a finite amount of ground that you can run your cattle on. And so you end up having to make what we call voluntary culls, where we're actually choosing who we get rid of. And these are the animals that are no longer, there's nothing wrong with them, but they're just no longer your best. And so if you're in the fortunate position where you're actually able to make voluntary culling decisions, that's where you can really improve the quality of your herd. Whereas involuntary culling decisions are things like empty cows, sick cows, crook cows, lame cows, mastitic cows, cows whose udder ligaments have let go, cows whose teeth are no good, cows with eye cancers, so that sort of stuff. So there's yeah, it's a terrible answer because there isn't really one.
Yeah, we got another question kind of along that line about culling animals. So they have some heifers with 5 or 6 teats. Is that maybe reason to look at culling or just keep an eye on? Or
Those supernumerary teats or extra teats, depending on like they rarely or never produce out of the six teats. They almost always only have four functional teats. Um, we in our dairy cows, we actually cut them off. So we identify which is the supernumerary teat. We do that at disbudding. So when they're little baby calves, we knock them out, we burn their horn buds, and then we check them for hernias. We check them for supernumerary teats, and if they've got extra teats, we cut them off. Having six teats, there'll only be four that are functional. The two at the back, that are the little nibby ones, they often just have a little bit of milk in them, but rarely they rarely do anything of concern. And they're a little bit unattractive. I'm a bit of an aesthetics person. I like pretty cows, but it's functionally not important.
all right, we got a question here about pre-testing. So is there a time where they're too late stage pregnancy to check with your calf if you're not sure?
Never. There's never a time where it's too late. I've preg tested cows right up until the point where they were calving the next day, so that people want to know yes or no. What the challenge is that once we get beyond about 14 weeks of pregnancy, 14, maybe 16 weeks of pregnancy, with the scan or even by hand, you're getting to a stage where it becomes more and more difficult to be really accurate. In 5, 6, 7, 8, 9 weeks, most skilled preg testers will be preg tested within 1 week of their correct date. So, like if it's 9 weeks, I'll call it 10 or I'll call it 8. It won't be much far further than that range. Once you sort of get to 10 to 14, maybe even 10 to 16 or 18 weeks, you can probably even stretch that to 1.5 to 2 weeks. And once you get beyond like 20 weeks or 5 months pregnant, then it becomes challenging, to be perfectly honest, because you lose the fetus, it's down deep in the cow, and even when you're scanning, you're going off things like size of cotyledons. We're not able to accurately determine the age of the pregnancy. So from the point of view of yes, no, we can do yes, no pregnancy testing from usually around 5 to 6 weeks all the way out to 5 hours before they calve. But accurately aging that pregnancy, we probably realistically want to do them before 16 weeks. And anything between 5 and 16 weeks, we can give you a pretty accurate date. And so we much prefer early preg testing. If people are wanting to sex pregnancies, I suck at it, but a couple of the vets that I work with are really good at it. They probably try to do them around about that 9 to 10-ish weeks when they're scanning them around at 70 to 80 days. Something around there is when they're usually scanning them to sex them. But we can usually do it quite comfortably under that sort of 4 months and get an accurate date. After that, like I now have got to the point where I'm old enough and wise enough that I start now saying 6+. And so anything between about 5.5 and the brink of calving tomorrow, I'll just now call 6+, because I've been burned that many times by people saying, "Oh, is she 6 or 7?" And I'll go, "Oh, she's probably 7." And then she doesn't calve for 3 months, and they go, "Oh, you were wrong." And I'm sick of that. I'm old enough now to know that you just can't be accurate beyond about that sort of 16 weeks.
Awesome. We've got a question here about a bit of education. Sometimes vets are in short supply and hard to get out to the farm when you need them. Is there any course you would recommend for them to complete, like a TAFE certificate that would be really
I was going
beneficial?
to say a vet course would be great. Look, you're right. There's a genuine shortage, not even necessarily of vets, but large animal vets willing to, and particularly, and this is a real issue, particularly in some of the areas that are not now like really popular dairy farming areas. Some of the areas where there's not a lot of work for the vets, they don't have the opportunity to get upskilled, and so there is a requirement for people to become very self-sufficient. There are various sort of methods, like in the dairy industry, we have people that do dairy apprenticeships. There's all these kinds of continuing education stuff. I know Dairy Australia puts on regular training on lameness and on all sorts of things. Calving, as I say, is really for me. I don't think there's a course that you can do that teaches you how to do calvings. But what I do think is that if you follow that concept of a 20-minute rule and you try something, and if you're making no progress, you try something slightly different. And if you're making no progress, you ask somebody who knows more or knows better or has more experience. There's often neighbors, friends, family that can help with that journey. And I do think that learning, experiential learning, is probably much more likely to be of what you're going to be able to do than actually, there's no really good training courses where you can go out and get trained. I know that there's a girl who was running a calving course, and I actually only asked her yesterday, can non-vets do this course? And they said no, it's for young vets to become upskilled. I said that's a real shame. It'd be great if you could get a course where people who are experienced herdsmen but just want to learn more have the opportunity to go out and actually do that. Yeah, maybe there's an opportunity for that someone to do it, but it's hard because I know a couple of the TAFEs have got the preg testing cows, and a couple of the universities have now got the blow up uteruses where you can get calves and sort of put them in all funny positions, and then they've got a uterus that you can blow up around them so that it puts like a bit of a natural feel. And those things, those resources are available, but I don't know of any courses as such. Sorry.
All right. Well, we might have one more. We've got a question here. Oh, where was it? Oh, did I lose it? Yeah, about breech presentation. So they have had a few of them in the past and a little bit concerned. Could that be contributed by slightly overweight cows?
Probably not. So there's breech and there's backwards. So not knowing whether they're meaning calves coming backwards, where as I say, the feet are presenting up like this, coming out just, and the calf is just coming backwards. That's a normal abnormality. Like it's an alternative presentation to a forward diving out presentation. A breech calving, what I consider a breech calving, is when you put your hand in and there's just a bum and a tail, and the feet are sort of up underneath the calf, like in almost like the calf, say in a crouching position, coming backwards, and they're quite challenging because you've got to be able to flex the fetlock, push the hock forward, and sort of push and pull and rotate, and then get those legs up, and you turn a breech into a backwards presentation. So you get the calf that's got the bum presenting, the feet forward, and just maybe some hocks sticking up in the pelvis. If you've got that, I think that's a different problem to the backwards coming calves. Backwards coming calves quite normal, probably nothing to do with them being fat. Breech presentations, probably nothing to do with them being fat, but just really bad luck if you're getting more than your share. And over a period of time, you probably won't get more than say 15 or 20% of calves coming backwards. That would be a really exceptional number. And as I think I said earlier tonight, or maybe it was last night, I often go a little earlier on helping those calves. If I see those back feet, instead of front feet like this, I've got back feet like that, upside down. And if I can pull them so that the foot comes out and the little pointy bit of the hock is actually at the vulva, and I can feel that the cervix is fully open, and I can think I'll often pull those rather than leave them, even though often they can deliver them quite successfully themselves. It's probably one area that I do tend to assist more than I probably need to, just because I do think those backwards calves are more prone to dying during the birthing process.
All right, awesome. I think we might nearly wrap it up there. Someone did say the beef fundamentals course with local lands is good and free, so maybe check that one out. But yeah, we might wrap it up. So thanks, Rob. That was some awesome presentations. Everyone, I yeah, guarantee people got away. We got so many questions here. We probably could have done another webinar just on Q&As. So yeah, it must have been very engaging. So yeah, I'd like to thank you, and yeah, looking forward to any in the future that we do. So. Yeah, thank you for everyone attending, and I'll send out the slides. And yeah, the recording will be up on our YouTube channel soon. So yeah, thanks everyone, and thank you, Rob.
My pleasure. Thanks everybody for staying on the line and putting up with my ramblings.
Awesome. All right, see you everyone.